We have the third scientific session, a symposia on Ayurveda for lifestyle disorders. Commencing the session, I welcome Dr. V.G. Huddar. Dr. V.G. Huddar is currently additional professor in the Department of Kaya Chikitsa. We welcome you, sir, to have your insightful thoughts on the topic Ayurveda and cancer care. Over to you, sir.
Good evening to all. First of all, I would like to thank the organizers, AFI, particularly Dr. Mohan Biradar sir and the whole team of AFI and AYUSH TV. So with the interest of time, I will be just in the next 10 to 15 minutes, we'll be giving a message that what exactly it is happening in the field of cancer, particularly that is integrative oncology. So all we know that what is integration actually, to make it brief, that it is an exchange that where the fulfilling the weakness of one with the strength of the each other. So if someone is weak in other system, we are supporting if we have a strength in there. So in that way, the lifestyle disorders are one of the strengths of Ayurveda, where they believe change in lifestyle and the preventive aspects has been more emphasized by the Ayurveda Samhitas and the Acharyas. So that is the strength, but particularly when we talk about the lifestyle disorders, one of the dreadful and important diseases comes into a picture is the cancer. So it is so common nowadays, one or the other relatives very nearby to us are suffering with this condition, and it is time for us to join hands with the conventional system also to make the comprehensive treatment. So in terms of usually, when we approach to the cancer, so there the naming of the disease becomes very less important, even though with the name of Arbuda, Granthi, Gulma, Visarpa, Vrana, and diagnosis as per the condition has been mentioned in the classics, but always we think and understand these conditions on the basis of the involvement of the predominant doshas and the doshas and the samprapti we frame, and accordingly we plan the Shodhana, Shamana and Rasayana Chikitsa. So that is the basic key things we in each and every case, because there is no standard treatment like for this cancer, this is the way in that. So how it is going to present with us, in what condition, with which predominancy of the doshas and the dhatus, we'll plan the line of treatment for them. If you see the pathology, I'll be not going in detail with this. In the left side, if you see, these are the faulty diet and lifestyle, including the genetic predisposition, is causing many of the risk factors. Like initially how the patient is presents with in such condition is simple things like indigestion, flatulence, constipation. It starts from there. And Ayurveda also believes all the disease starts from the gut only. So in that way, so you consider at that level as Agnimandya, Ajirna and Ama seems to be very simple disorders, but they in the long run, they are going to cause a lot of impact on the lifestyle disorders like hypercholesterolemia, fatty liver, obesity, PCOD, diabetes, CVD, CVA, including cancer also. So in the stage wise, we are going to manage them. On the right side, you can see the approach of the treatment when we diagnose them. So this is a simple thing to say that the lifestyle, how the things are going on as per the Ayurveda diagnosis also, and in the similar ways we can understand in the allopathic conditions also and plan the treatment. Next. So here, as I was telling, the dhatu involvement and the dhatu poshana is an important aspect to understand, and that is the next level, that because in particularly cancer we consider this, that is the impairment in the dhatu poshana. So abnormal cells, like all why it happens, there is rasa to rakta, and if all the metabolism is okay, then the dhatus, samadhatus will be there. Otherwise, if any impairment happens in these things, definitely it's going to cause the abnormal accumulation of any of these doshas, especially in the form of tumors also. It is one of the mamsa and medha related condition. Next, it can be compared with the stem cell therapy, as Dr. B.S. Prasad sir has postulated that. I am giving a credit to him for this. So for the research purpose, we can understand at the stem cell level, and the same thing, the cells are differentiating into different tissues in the similar way, rasa to rakta, mamsa, medha. So all these tissues are embedded and understood in the 7 dhatus only. So these are all of we know. So in the strength of Ayurveda, particularly in the cancer management, now is in the prevention aspect, which is the major area but the neglected area. Right now we are all running behind the curing the conditions the cancer patient comes to us. But rather than that, we need to focus on the prevention, which is our more strength, and it can be become a huge game changer if we properly follow that. And it has to go into the health level at the primary root level also, and it has to the culture, the dinacharya, rutucharya, everything we have forgotten now. So all these things, if it is inculcated properly, so that can be a game changer from the primary health setup also, so that we can change at least a 5 to 10% of change, and prevention means a lot from in the case of cancer conditions. So these are our strength areas like Shamana, Shodhana, Rasayana, Yoga, Pranayama and counseling. All the holistic approach, not only considering on only the medication to particular disease. So here, this is the one template which we have prepared for the integration purpose in National Cancer Institute of AIMS in Jajjar, which is recently opened. It's a cancer unit. So we have distributed this type of templates to them so that they can understand at least where Ayurveda is having their strength, where the patients can be referred. So likewise, we have given like prevention prologue, what we can do in the preventive oncology cases, and adjuvant to prior, during and post chemo radiation. The medical oncology and the radiation oncology people will be working in these areas. And the add-on therapies, that is refractory for chemo radiotherapy, we can say the stand-alone therapy sometimes, because here the patients sometimes they are not fit for that and sometimes don't want to go there, and they have a severe problems with the chemo and radio toxicities. In such conditions, definitely they will turn to us with the consent, with the proper situation understanding. We have to advise sincerely and properly to those patients to undergo stand-alone therapy. Next. So here, as I have told, the strategy one is chemo prevention. Chemo prevention, that is to provide a primary prevention to the susceptible population to reduce their chance of developing the disease through both pharmacological and non-pharmacological interventions, either the medications or by the lifestyle or by the panchakarma. Next. The strategy two, that is add-on therapy. The treatment is going on, allopathic treatment. Along with that, we are going to give some of the medications. Only the challenge in this condition is drug interactions. That's a major challenge. The allopathic people and even the patients are aware that whatever the medicines given by the allopathy people and what we are giving, whether they are interacting with each other, it's a research aspect again, because now we are practicing, but the question needs to be solved with the researchers. So strategy 3 is a standalone therapy again. The standalone therapy is a curative aspect, and many of the cases we have come across, and the few publications are also there with a standalone therapy. We have cured the cases. 1 or 2 cases are there, that also I am just going to show in the further slides. Next. So prevention of recurrence is the prevention, primary prevention is the one, and another is the secondary prevention, and the prevention of recurrence is the very key area where the patient completes the treatment and he is disease free, and then now we give medications to prevent the recurrences. We have taken several research projects with the aims that the breast cancer patients are completing the treatment, and then we are administering our treatment for 2 years, and then we are observing them for the recurrences with a control group where Ayurveda treatment is not taken. In that model, we are doing the researches. If we come across with a prevention of, that's why I told at least 5 to 10% preventable, so that it matters a lot in such a conditions. So this is strategy 5, chemo radio adjuvant therapy. Presently, this is the safest method for us, and we have a strength in that, and it's a low-hanging fruit like. Nobody will question, because it is a very important area where the allopathic oncologist will have something to make their quality of patient's quality of life better. So this is the intention of that. So here few of the medications I try to mention. It is not a whole and soul, just a few preparations like we come across with a pain. So pain management, again, it is a challenge for those patients, but we can support add-on therapies with Shodhita Bhanga, Trailokya, Vijayavati, Kupilu contained yogas, external therapies, panchakarmas, relaxation techniques. These can contribute well to pain management. And next is about the cachexia, diarrhea, cyanosis. Likewise, many such preparations are there we can have for these patients as a add-on therapies or complementing to each other. Vomiting most of the times, nausea is vomiting, skin rashes. So all the Vata and Pitta predominant features will be seen during these chemotherapy and radiotherapies. All will be managed with that. And the constipation is another problem in many patients, and again diarrhea also. We need to check what exactly the condition is. So breathlessness, next, cough, delirium, lymphedema, and see, these are some of the Vata Pitta Shamana drugs, Rasayana, diet and yoga in case of chemo and radio protection. The chemo and radiotherapy is going on. To protect that, what we can give, usually the Grita preparations we prefer in the practice, and Vishahara Chikitsa, Bilvadi Gudika, and Brahma Rasayanas. These are well practiced nowadays. Brahma Rasayana, Amalaki Rasayana, Narasimha Rasayana, these are given along with that, and researches are also published like this. This is about the Rasayanas and radio-induced damage. Such publications also we get. Next. So again, mental support with a diet lifestyle. Again, the yoga pranayama definitely a role here, along with Medhya Rasayanas and the Sattva Vijaya Chikitsa. So the therapeutic procedures, very less opportunities will come, but still we can make out few of these procedures like Virechana, Basti, Nasya, Lepa. Before starting the chemotherapy also, along with the chemotherapy also we have planned, and after the chemotherapy also we can plan these preparations as per the condition of the patient, because the bala of the patient is very important. Looking to that we have to, otherwise it gives bad effects also sometimes. So as I have told about the Rasayanas, in this way the Rasayanas can be understood like we get the patients for the preventive purpose. Mainly the Rasayanas are for the preventive purpose and to manage the chemo and radio side effects. So here the positive family history having patients, population will be there. Exposed to risk factors like alcohol, tobacco, smoking, such people are also there. And few of them are there, they are not having any family history of cancer, and they are not having risk of these exposure also, the risk factors. In such conditions, different particular Rasayanas can be chosen as per the, someone is having lung cancer in their family or someone is having breast cancer. So accordingly we can make out the plan, and then accordingly we can advise them to go for the lifestyle continuously, which is feasible. So these are some of the proved activities of the formulations of Rasayana. Next. So this is the one case of lentiginous melanoma. These are the medications which are given. This is one of the rarest rare conditions of the skin malignancies. Next. So these are the treatments. I will not be going in detail. If it is because of the time constraint, I will not be going in detail. The organizers will be having mail IDs. We can discuss later also if interested. It is a lesson for us also. This is the image before and after. Next. This is a squamous cell carcinoma of the tonsil with a metastasis. Next. So next. These are the images before and after the treatment. Very much good improvements were seen. Next. So this is the thyroid cancer also, we get a good results. Next. So this is the tumor, the size of the gland, the tumor which is there, it has been reduced significantly. And in leukemia also we have a very good results. Leukemia cases we have a good results. In brain malignancies we have a good results. Lymphomas, non-Hodgkin's lymphomas, in such conditions also we have a good results. So these are the medications used, and this patient since last 4 to 5 years he is following with that, and his graph next, his all total leukocyte count completely coming down. With the patient is very weak but still is very maintained. After 5 years also he comes to the OPD and takes the medicine. Next. So next. So this is a very interesting case of CA breast with a metastasis in the brain. Next. The medications were given, simple medications for a long term it has been given with the Rasoshadis also. So after some time we can see in the reports, this is the PET scan before and the after treatment without any single medications of allopathy. This is also a surprising, we cannot expect it into all the patients, but we need to learn from that patient what has given the results. But totally that activity in the breast has, inactive lesion was there, and the metastasis in the brain was completely disappeared, which we can see in the PET scan also. Next one. So these are few of the conditions, and we run the journals also, and we have Center for Integrative Oncology in All India Institute of Ayurveda where we run the OPD. Next. So this is the journal recently launched only for the cancer report cases, genuine cases we are going to publish here next. So these are the protocols, integrative protocols with the allopathy physicians to start together, and we have published the breast cancer protocol also, next one. Breast cancer protocol recently, Aroha seminar we have released it, and this is the cases, which different cases, next. So this is the NCI, National Cancer Institute Judger unit, our unit. So treating physicians integration is very important to make a key success. We need to understand each other. So without that, if you make a policies, nothing is going to happen. Only the understanding of the physicians internally definitely going to work integration about next. So thank you for giving the opportunity. Thank you, Unani.
Thank you for the insightful session, sir. Now I invite Dr. Pradeep Gram Purohit, Professor, KLE Ayurveda Mahavidyalaya, Belgaum. I welcome you, sir, to provide your insightful words on the topic Panchakarma in health maintenance and managing diseases. Over to you, sir.
Good evening, everyone. Topic is general practice in Panchakarma for practitioners. Now I turned into that is Sarala Panchakarma. How best the practitioners can practice Panchakarma, as well as how best the person can practice lifestyle modification in the GPs. So after seeing college, building and hospital, general practitioners may think that how we can practice Panchakarma. It is highly impossible, and how so many hurdles are there, how many difficulties are there, like that they may think. But in this presentation, very Sarala Panchakarma, how best the person can practice, these things only will discuss with the lifestyle disorders and how the treatment can be adopted in the GPs. So if you see the this picture, everyone will think that this is Dhara only globally accepted. But globally, so many Panchakarma treatments have been accepted, but in village level, still it is under question mark. Our practitioners are not practicing Panchakarma. When it is going to be adopted in the village level practice of Panchakarma, definitely we can say that it is reached village as well as global. So Panchakarma is started in the 1996. Next slide, please. And so many PGs have come up with post graduations and completed Panchakarma, and more than 30 PhDs have completed. With all these, now we can say that so many scholars, so many practitioners are started doing Panchakarma in their village, taluk level, two-tier cities, so many in areas Panchakarma started. So if you are planning for Panchakarma, at least you cannot not to be go with 10 rooms of female section, male section, not required. Only with one therapy room with attached toilet, bathroom is going to be sufficient with hygienic maintenance. These are the next slide, please. These are some requirements you can keep in your Panchakarma theatres, minimum requirements for the preparation concerned, basti or some snehapana preparations or something. You can uniquely you can prepare Beshajagara in your setup. Next slide. And some double entry like that you can modify your Panchakarma setup. Next slide, please. Like this, you can go with one Dhara Abhyanga table as well as steam chamber also you can keep and plan for this. Next. Next, please. And if you want to have good setup, definitely you can have the more scope to develop Panchakarma Deluxe as well as some other setup also. And if you want to plan for the pediatric after the completion of MD in pediatric Panchakarma also you can go with a setup. And some instruments are available nowadays. So many technology have been introduced for the Panchakarma concern for Janubasti preparation, Janubasti treatment, Katibasti, like that Grivabasti. So many instruments have been introduced with the acrylic materials. And this methodology is very easy to practice in GP practice. So you need to go with at least with this, so we can counter maximum n number of lifestyle disorders. Next, please. Next, please. So innovation is mandatory in our Ayurveda system. So with this intention, so many innovations have been established. And I think in the OPD basis also, we can practice Basti treatment in so many lifestyle disorders that is concerned with obesity also. We can go for the Yoga Basti, Kala Basti, Karma Basti, and some Udvartana treatment as well as Abhyanga. And in the OPD basis also, we can plan out for the Virechana. And sometimes if you are able to conduct, if you are very confident, definitely you can plan for the Vamana treatment also, along with so many methodologies are there. So otherwise you can get with experts, you can plan for the treatment also. And so many Vamana as well as Virechana we have conducted in cardiac pathology also. And some newly diagnosed cases of hypertensive diabetic cases also we have done so many Vamana treatment as well as Virechana treatment. With this treatment, we can get very good improvement as well as the person can get it from all these hurdles, and without medication also we can change the lifestyle, all the hurdles. And some of the Basti instruments are there nowadays, so many innovative Basti enema cans are available. These also in the GP practice you can practice. And automated Basti yantras are there. Other automated, we can go with prepared kashaya is also available. These also can be practiced in your practices. And Nashya is one treatment in OPD basis you can practice, even though it is not good setup of Panchakarma. You can counter so many disorders, newly cases of hypertensive as well as anidra is there, and psychological disorders are there. You start with Anutaila, Kshirabala Taila, or recurrent so many eosinophil count will be high, and allergic rhinitis also you can practice Pradhamananasya. At least you can keep these 3 drugs in your GP practice. Definitely you can get more and more results along with so many other medications. Next. And even you can practice Alabu. If you are not getting any kind of Alabu, so many disorders are there, skin pathologies, that is eczema, psoriasis conditions. You can go with Alabu, that is with a syringe method you can practice. Definitely you can get so many improvement in the eczema as well as psoriasis. We have done many cases with single conditions. And appreciations will be there with all the improvements. And some of the lifestyle disorders are there. The person will be sitting in a long cases, and persons are sitting more than 6 hours, 8 hours. So many hurdles will come. Cervical spondylitis or some kind of low back pain. In all these conditions, the general practitioner practice very in a simple manner, that is Kati Basti. So for a period of 3 days, 5 days or 7 days, if you start doing these therapies with one therapist, definitely the person will start responding. No need to go for any all the time injection or some other oral medications. Sometimes these medicaments will be help a lot in the practices. And so many instruments also have been introduced. Automated heating modalities are there. These Kati Bastis can be applied. In the same way, and Parisheka also can be done in neurological conditions and cervical spondylitis. These are the Griva Basti, Janu Bastis. Next slide. And Nadi Sveda. This is one I request all the GP practitioners, at least if you are not having any steam chamber, only one Abhyanga temple is there, at least go with the steam, that is Nadi Sveda. With the Nadi Sveda, so many disorders can be countered. That is musculoskeletal disorders as well as neurological conditions can be countered only with the Nadi Sveda. That is Mrudu Sveda, Madhyama Sveda, Mahan Sveda. Like that you can practice with the Nadi Sveda and one Abhyanga table. So many drugs, modalities can be applied in this. And if you could able to practice Shashtik Shali Pinda Sveda, Patrapinda Sveda, next line. So many in your near places you can get so many Eranda Patra, Nirgundi Patra in your places. Try to go with the Patrapinda Sveda in many disorders as well as Parisheka. And even simple Karna Purna also you can practice in the general practice. That is in case of Manyagraha, Hanugraha, Shiragraha, Karna Shula and Badhirya. Simple medications will be give maximum results in your GP practice. Try to adopt these medicines and these go with the practices, and definitely we can get maximum results. Like that, so many lifestyle disorders can be counter with the Virechana treatment, then Rasayana therapies can be adopted. Once we start this practice of Panchakarma in the general practice, then we can develop the evidence-based practices. At least in some 10 cases, we got 40% of result, 50% of results. Like that, one by one disease, if you start countering with the Panchakarma treatment in OPD basis also in the general practice, definitely one other day, we can say that from village to global, our Panchakarma practice is there. Then only we can fulfill all the, whatever the AFI is conducting this kind of conferences for general practice, definitely it is going to fulfill after learning so many things as well as adopting of all these practices in your places. Thank you.